Today on the Doc on the Run podcast, we're talking about how runners with Achilles tendonitis skip the doctor visit and keep running. Hi, I'm Dr. Christopher Segler, and thanks for tuning in to the Doc on the Run podcast, where we help you understand how to keep training and running even if you've been injured. The Achilles tendon is the biggest tendon in the body, so when the Achilles tendon gets injured, the runner has a really big problem. If you neglect the early signs of problems with the Achilles tendon and develop a severe form of Achilles tendonitis, you can be crippled temporarily and have your running form altered permanently. In short, you may never run the same again. If you've been running with an aching pain in the back of your leg down near your heel and you worry you have Achilles tendonitis, you're probably freaked out and concerned that you're going to have to stop running. But don't worry. I'm going to explain to you exactly what runners do that helps them get over those early forms of Achilles tendonitis without ever seeing a doctor. Even though it is possible to continue running and continue training if you developed a case of Achilles tendonitis, you shouldn't feel bad about any fear or anxiety you may have developed. After all, the very name Achilles is based in mythology designed to inflict fear. You don't have to search long before you find articles that say something frightening about Achilles tendonitis. No more running is what most runners fear when the Achilles starts to ache. But don't let the alarmist scare you into a state of panic. There is always a solution. You just need the right solution for you, your running style, and your running goals. The trick to figuring out what you should do with your aching Achilles is to first determine how bad the problem may be. Once you understand the extent of the problem, you can decide on the best way to calm it down, heal the Achilles, and get back to running. So who is this Achilles guy anyway? Well, according to Greek mythology, when Achilles was born, his mother tried to make him immortal by dipping him into the river Styx. However, when she dipped him in, she forgot the spot on the heel she had held him by, which left this one small area unprotected. In the end, Achilles was struck by an arrow in his vulnerable heel and he was killed. Achilles shares his vulnerability with the rest of us entirely mortal runners, and that is why the tendon which connects the calf muscle to the heel bone bears his name today. But again, the Achilles tendon is the largest tendon in the entire human body, and it is very strong, but it is also, interestingly, the tendon we rupture the most often. Any runner can suffer from Achilles tendonitis. It's a common overuse injury and inflammation of the tendon, but the key is to heal it as quickly as possible so the trouble doesn't progress from one stage to the next. Now, if you've been researching Achilles tendonitis, there's something you have to be aware of. There's this rather unfortunate trend in medicine today that actually says doctors should only speak of Achilles tendinopathy when there's an Achilles tendon issue. Now, the suffix in tendinopathy comes from the word pathos, meaning something is diseased or pathologic. Of course, if your tendon hurts when you run, you already know something is wrong with it, so that term doesn't help you decide what to do. If you want to make a decision about whether you can run, if you should rest, whatever, you need to determine what form of trouble is present in the tendon. There are several stages of Achilles tendon problems, so let's talk about each of these. The first thing that happens with the Achilles tendon is you get Achilles paratendinitis. The prefix para means around, and the suffix itis just means inflammation. The earliest form of Achilles tendon trouble is Achilles paratendinitis. This means you have inflammation surrounding the tendon, but not within the tendon itself. In cases of Achilles paratendinitis, there's inflammatory fluid accumulating between the Achilles tendon and the peritoneum. The peritoneum is a thin covering or outer layer of tissue surrounding the tendon. In surgery, when we operate on the Achilles tendon, we look at the peritoneum. It basically looks like very thin plastic wrap, like saran wrap. As we cut through the peritoneum and separate it from the Achilles tendon, we see all these very little fine fibers, sort of like cobwebs, stretching apart and separating as we peel away the peritoneum. Well, those little cobweb-like fibers are actually nerve fibers. If you have a little bit of overuse of the Achilles, inflammatory fluid starts accumulating between the Achilles tendon and the peritoneum. The inflammatory fluid pooling in there causes a bulge, stretching the peritoneum and pulling on those little nerve fibers, and that causes discomfort of some sort, often mild aching pain, but it can be other stuff that we'll talk about later as well. Achilles tendonitis is inflammation within the tendon itself. Achilles tendonitis occurs anywhere within the tendon, all the way from the heel bone up to the calf muscle. However, most often the Achilles tendonitis occurs in a very specific area just above the heel bone. This area happens to have decreased blood flow as compared to the rest of the tendon. For this reason, an overused tendon may become weaker, inflamed, and injured in this particular area. Now, doctors refer to this specific area of the Achilles tendon as the watershed region. Fortunately, in the majority of cases, Achilles tendonitis is short-lived. It may begin with a small injury or a particularly strenuous workout. However, runners, triathletes, and other active people often continue to exercise in spite of the pain. When this occurs, a normal inflammatory response that is supposed to cause healing in the tendon can backfire. When chronic inflammation of the Achilles tendon begins, the inflammatory cells can actually cause damage within the tendon and degenerate the collagen that makes up the substance of the heel cord. This degeneration of the Achilles tendon is referred to by doctors as Achilles Tendinosis. Achilles tendinosis, again, is just degeneration of the collagen that makes up the tendon. It's caused by chronic inflammation and irritation of the substance of the tendon. As it progresses, the fibers of the tendon start to become disorganized. They become weaker and more prone to microscopic tears. Over time, the tearing of the Achilles tendon can progress and make it even weaker. It then often becomes prone to rupture or complete tearing. In some cases, the Achilles tendon may rip away from its attachment in the back of the heel bone. Now, incredibly, sometimes this sort of injury isn't even painful, but that's another episode. If you notice a lump or a firm knot in the back of the Achilles tendon just above the heel bone, this is most likely the development of Achilles tendinosis. Now, it may or may not be painful if you squeeze it, if it's degenerated and you've developed Achilles tendinosis, particularly if it's been there a long time. Because this sort of mass in the Achilles tendon is usually degeneration that makes the tendon weaker, it's very important to seek treatment to avoid damage to the tendon. If you think about this, if you've developed actual damage to the collagen in the tendon in such a way that it's actually physically and morphologically different from your other tendon, where it's lumpy and firm and different, well, you have to think of that as a severe form of Achilles tendonitis. I mean, wouldn't you agree? It's different. One thing you have to understand if you're really worried about your Achilles tendon is that Achilles tendons in runners don't rip, rupture, or tear without first developing tendinosis. But if they do become weaker because of neglect and refusal to fix the problem in its early stages, the tendon can get weaker. If the Achilles tendon is weak and you're training hard, you can get a partially torn Achilles tendon or even a complete rupture of the Achilles tendon. All three of these conditions, a partial rupture, full rupture, Achilles tendinosis, they're what I think of as the most severe form of Achilles tendonitis. And we'll talk about all of those in great detail in part 2 of this series. But the goal here is to make sure you know how to deal with the early mild Achilles tendon issues, heal fast, and avoid any of the more severe forms of Achilles tendonitis. If you have a question that you would like answered as a future edition of the Doc on the Run podcast, send it to me, and then make sure you join me in the next edition of the Doc on the Run podcast. Thanks again for listening.